When we make decisions based on the best evidence that we have at that time. And if the evidence changes, we change. That's the definition of science.
The presence of teeth is so fundamental in almost every aspect of life, from speech, obviously gaining nutrition, but feeling confident.
The improvement of the oral health in our patients will improve their overall health in leaps and bounds. And it's time for us to reconnect the mouth to the body, especially in the payer system.
Dentists, are you ready to take your practice to the next level? Directa USA, the North American arm of Directa Dental Group, brings you innovative, high-quality products from around the world, designed to improve both your technique and patient outcomes. We're more than just products. We're a partner in your success. With a solution-based approach and expert-backed innovation, Directa USA helps you provide the best care possible. Better products mean better dentistry. Visit them today at directausa.com. Welcome back to On the Cusp. I'm your host, Dr. Brett Gilbert, and so excited to have an incredible return guest, Dr. Brett Kessler, who's become a dear friend and brother to me, someone that I met through the ADA, and on his way up the ladder to put himself front and center, fast forward into president of the American Dental Association, which he has stepped into with a vigor, with a zest, and with the enthusiasm of just someone who cares so much about others and wants to put himself in front and be able to really support dentists and dentistry. But what I love about his initiatives is really he's thinking about dental patients and the public. And Dr. Brett Kessler is a practicing dentist, not so much right this minute because he's on the move. He's all over the country. He's been international, meeting with other leaders, discussing policy, listening. I know Brett is a listener, so I know he's doing a lot of listening, but also doing a lot of sharing about what he believes to be the best direction for dentistry. Dr. Brett Kessler is someone that I respect with so much of my heart because of the man that he is. If you were not privy or haven't listened to our first episode together, he shares his personal story, which is incredibly compelling and inspiring. But we're moving forward into, here we are with the sitting president of the American Dental Association, Dr. Brett Kessler. First and foremost, Brett, just want to welcome you in and say hello, but just let you know how much I personally and how much collectively we appreciate all the time and effort you're putting into dentistry.
Thanks, Brett. It's awesome to be here, and I appreciate the support. And it's a mutual admiration society, my friend. You do so much for this profession and for me, keeping me centered and grounded, and keeping things real. And really great to be here.
So fun fact: not only are we brothers and dentists, not only do we share the same name, but we also have the same birthday. So, you can't make this stuff up. We are soulmates.
I think I'm much older than you, though.
Just a smidge, maybe, but that's all. So, hey, Brett, I want to jump in. I mean, you now were elected president of the American Dental Association last October. Obviously, we went through an election here in the United States of America, and you walked yourself right into, in essence, a significant dental public health situation in terms of this newfounded issue regarding water fluoridation. So I just wanted to take an opportunity to lead off the episode to talk a little bit about what you're hearing, what you're learning. I think as dentists, we all recognize how important from a public health perspective, from preventing tooth decay, and ultimately what downstream tooth decay does, especially to children when unchecked, when untreated, is the fact that we have examples from around the world of removing fluoride from the water being a disastrous situation for the public health, especially of our children, and most especially those without great access to care, those without with less resources. So, Brett, can you talk a little bit about right now where we stand with this issue and what we as dentists might be able to do to contribute to informing the public and informing our colleagues of how important it is to remain in balance with water fluoridation in our public health system?
Sure. Way to, open up the gates and we start running, right? We're in a very volatile political climate right now. And the current administration is challenging the science behind fluoride, claiming it is dangerous. It's causing lower IQ in children, and there's no studies that really prove that. There's no correlation between fluoride intake, especially at the level that we're at in this country, and lower IQ and other problems. An overdose of it, too much of anything, is a bad thing for sure. But the ADA, the American Dental Association, we are a science-based organization. Two of our core values are science and evidence-based. And when science is challenged and we know the correct science needs to be brought forward, we are loud and proud about it. I've been giving press statements all over the country that have gone all over the world. As of a few weeks ago, the reach has been over 27 billion views. Never before, the opportunity here is never before has oral health been brought to the level of the President of the United States. The conversation is now at that level, and we have to stand up for what we know. What can anybody do? What can a practicing dentist do? I'm sure everybody is getting asked from their patients, what's up with fluoride? I don't want fluoride. Is it safe? Is it not safe? And you as a dentist have this opportunity to educate your patients on true science. But also we have to respect the fact that some don't want fluoride, and I've had that my entire career. And when they say they don't want fluoride, we have to be, honest about, what their risk now is increased, and now their oral hygiene has to improve, and their diet must exclude most of the sugars in our diets in this country. A few weeks ago, I was given the opportunity, along with Dr. Rich Rosado, the president-elect, and Dr. Betsy Shapiro, our executive director, along with Jim Schultz and Matt Rosetto from our Washington team, to meet with Dr. Heidi Overton at the White House. And she is the deputy director of domestic policy, and she's heading the MAHA project. And the MAHA project report is due at the end of May, so in a few weeks. And we wanted to, so grateful that we got this opportunity to speak with her. And we had a great conversation about everything we're doing. And it was a 30-minute scheduled conversation, and it went about 45 minutes because she had a lot of questions. So I felt like we left that with a good feeling. Who knows what gets in the report, but at least we spoke to the people who can actually, stand up for science.
Wow, that's you're talking about going to the highest levels of government, and something that my friend Ronnie Rao has been talking a lot about is this new sort of, and this discussion and this conversation probably contributes to that, but recognizing that oral health is health. And oftentimes, sometimes the beginning of signs and symptoms of things that might be developing. So I think it's incredible. Now, I want to ask you, Brett, first and foremost, I want to acknowledge, just from an outsider's perspective, it seems like the ADA is working really well in concert right now. I love the collaborative approach of you and Rich. I see that you're coordinating, even with my endodontic specialty. You guys did a collaborative article that was recently released. I just feel like you're pulling the strings together, bringing the community together. And maybe that's because we are being questioned, maybe in this public health policy that has stood the test of time. There's no question about that. Ask people that grew up on well water if they wish that they would have had fluoride, and they'll probably tell you that the answer is yes. But I want to also hit you with the counterpoints really quickly, because just doing a quick search online, just trying to see, for the proponents of removing fluoride from the water, what are they standing behind? And I know that you've been privy, as president, you're probably in that red, purple, or green room, whatever it looks like, getting all the inside info. But when they talk about that fluoride in the water has a toxicity issue, I know that it's 0.7 milligrams per milliliter, correct, is supposed to be the level that's safe. What have you learned about the potential, just putting it out there, would there be a potential for fluoride to be toxic if it's in the water?
Yeah, and like I said before, too much of anything is not a good thing. And so there have been, that's just how fluoride was discovered as an adjunct that helps reduce cavities and make teeth more resistant to cavities. Colorado Springs back in the 1950s, there was a whole rash of people with dark teeth and spotted teeth, and they found it to be the fluoride in the water. But they also found these teeth were very resistant to cavities. And then, through, research, and actually the research that happened at the ADA Forsyth Institute out in Boston, they developed the standard of where the level should be. And so, too much fluoride, can cause problems, can cause, fluorosis, can cause neurotoxicity, can cause broken bones, but that's in levels way, way, way higher than what's in the water right now. Because we are a science-based organization, if the science shows that it is wrong, we'll change it. When we make decisions based on the best evidence that we have at that time. And if the evidence changes, we change. That's the definition of science. And, back in 2017, the EPA lowered the standard for how much fluoride should be in the water because of the multiple sources. And through public health modeling, and there's no perfect modeling and perfect way to tell, but through public health modeling, the 0.7 level is the level that is best suited for the population based on not just the water that they'll get the fluoride, but from all the other sources that they can get it from.
And also, Brett, is it each municipality that measures the level of fluoride, or how is it? I'm just trying to because what I want to present here, having you here, is that someone who's interested in this issue on either side can walk away feeling more informed. It's not my intention to twist someone into my opinion, which want to state I'm clearly in full favor of continuing to have fluoride in our water, but so it's a municipal responsibility to test the levels. And is that done yearly, monthly? Do you have a sense of that?
So every water system has a different governing body. Some have a private board, some have a public board, some it's county, some it's municipality. So it's all over the place. And so each municipality, each water municipality has their own methods for how often they're checking. The CDC, Department of Oral Health, was the aggregator and the monitor of all of those sources. And when they started seeing areas where it was too high or too low, they would, make recommendations to those municipalities to modify. But each municipality had its own autonomy on whether they wanted it or not, wanted it in the water. But then states like Utah and Florida have banned it outright as a state, and the municipalities then lost the ability to do that. But I testified before the Denver Water Board in 2017 because when the EPA lowered the limits, all the anti-fluoride people thought this was a great opportunity to go after a political or a scientific change for political gain. And I had to testify about the value of fluoride. And I wasn't an expert in fluoride back in 2017, and who knew I'd become the expert in fluoride in 2025. But you play the hand you're dealt. And but the bottom line is true science is true science. We are willing to do a study but it needs to be funded. If the government really feels that it needs to be studied, we'd love for them to fund a study, and we will figure out a way to do it in a very scientific way, non-biased and independent review, et cetera, double-blind placebo, and see what happens, because that's what science-based organizations do.
Well, everything happens for a reason. Everything is how it's to be. I think we all should be very grateful that it's you that happens to be the president in this moment, because of this is not a new fight for you. This is not a new topic for you. This is something I know you've been very passionate about going back now. It sounds like more than 10 years. Now, Brett, also, one of the big things that the proponents of removal are talking about is this idea of it being like forced medication. Now, what I love is seeing a lot of our medical colleagues coming out also, especially pediatric dentists, but pediatricians talking about the downfall of removal. And, this idea of forced medication is, to me, it's a tough argument to sell, because if you look at Calgary, and I'd like you to speak on that, I know that they had removed the fluoride from the water and saw some 700% increase in emergency room type visits for children. Can you speak a little bit about that?
Yeah, it was 700% increase in children's OR time. Okay, because there's so many kids that were just, their teeth were devastated by the lack of fluoride and their current diet, and so 700% increase in OR visits. OR, operating room, full mouth rehabs for kids. When Calgary took the fluoride out of the water, within a few years, 2 or 3 years, they saw a 25% increase in decay rates. In Buffalo, New York, they took the fluoride out of the water without telling anybody, and they saw a 25% increase in decay rates. So we know this is what is going to happen. And, and again, we're dentists, and we are doing our best to mitigate a dental problem. The dental problem is caused by our lifestyle and the sugar in our diets, which is sugar causes cavities. And that's one of the topics in the MAHA movement to, reduce sugar, reduce ultra processed food in our diets. And we're all for that. And we as dentists, have that conversation with our patients every day. Sugar causes cavity. You got to stop the sugar. And that's where I think we're going to have to make our biggest difference right now. So in Utah, we have the state dental director in Utah is ready to go, and they're ready to study the changes that could occur in decay rates. They've got baselines working right now. And so we will, be able to test that or study it as it happens. Nothing yet in Florida because it's too new. So we're ready to evaluate the landscape as things happen. We will, make recommendations. And I mentioned before the CDC Division of Oral Health. The CDC's Division of Oral Health has been eliminated from the CDC. And one of the things that we wanted to know when we met with Dr. Overton is, is the mission of the CDC Division of Oral Health still going to be part of the mission of the CDC? And we gave a lot of information about what the CDC did, what the Division of Oral Health did. And in addition to, monitoring the fluoride levels, it also monitored cavity rates, decay rates in all the communities in this country. And it also funded 20 state dental directors across this country. So there's several states now that are could lose their dental director, which is scary from, who's going to lead this. The Division of Oral Health creates safety guidelines and many practice acts, state practice acts, actually say in the Practice Act, the CDC Division of Oral Health, the guide what we look to. And so all of that is now in jeopardy. And we got to share that with Dr. Overton, and hopefully that'll make it back in. So, and also we talked about they're having budget cuts, and one of the big budget cuts they're looking at is an $880 billion decrease in Medicaid spending. And that leaves especially adult Medicaid in real big jeopardy. So here we're taking fluoride out of the water, and on the other end, we're taking away an opportunity to fix the problem that we're causing over here. We're very, very concerned about that. About choice and medication, forced medication, we talked about that a little while ago. Is fluoride forced medication? Some can perceive it as that, but fluoride is naturally found in the water. And so it's not like, some areas that it doesn't have it, we are adding it. Some areas that have too much, we are taking it out. But there's also iodine in the salt. There's also riboflavin in the wheat. And so it's that's what public health is. And a good public health initiative flies under the radar so you don't know what's happening. And so our parents' generation saw people with polio in the iron lungs, okay? And they know the devastation of polio and measles, and we haven't seen that. So why do we have to take the vaccines? And because, it's not here anymore, but that's why it's not here anymore. And same thing with fluoride. It flies under the radar, but it does so much good. In fact, it was recognized as one of the top 10 public health initiatives of the 20th century. That's how good it is. So we're in unfortunately, we're brewing a perfect storm right now. Yeah. And so we're going to have to be ready to do whatever it takes and be creative about it. So we are looking at other materials, other adjuncts that will help teeth be more resistant to decay, and calcium hydroxide, hydroxyapatite, things like Curodont. Those are things that really will help as topical agents, because in some states now they're challenging, or the FDA is looking to remove fluoride supplements. So now it's not a choice anymore if this is the case. And so we're going to know in the fall whether that is going to be true or not. And we're going to, again, fight for what we know is best and try and keep our patients healthy as best as we can.
Yeah, and I think, you said perfect storm. I think that is really fitting here because, all of these things considered, we also have to look at what the food supply chain looks like in the United States, especially in the lower income, what a lower income family can afford to do to provide food for their family, what's in the convenience stores, what's even sold at school or given out as lunches. So you're really in a situation where the whole deck is set against the public in terms of dental prevention. We know as endodontists, we're the tooth savers. This happens to be Save Your Tooth Month. And a lot of research has gone into looking at how human beings value their natural teeth. I know from some of the mission work that I've done, the presence of teeth is so fundamental in almost every aspect of life, from speech, obviously gaining nutrition, but feeling confident, getting a job, holding a job, getting a mate, all of these things. So if we're setting kids up to potentially lose their permanent dentition, and then all of the problems with airway and breathing and chewing, to me, it's an absolute disaster to consider removing this essential element, to your point, that is naturally found in the water. It just feels like, this is a moment when we have to recognize the disparity of our population in terms of even what type of food is available in different neighborhoods. I know in Chicago, that's always a big discussion is, there is no Whole Foods in certain parts of the city. And therefore, the people there are just basically getting what they can. And it's typically high sugar, the type of ultra processed food, fast food. So, man, Brett, I just acknowledge what you guys are doing. I'm here to support. I've been trying to share on my social channels just facts and information about fluoridation in the water, how important it is. As you said, it's been almost a celebrated prize of public health policy in this century. And so, listen, every topic, every issue has its right to be, tossed around and figured out. I'm really hopeful that we will land on the idea here that fluoridation in the water is critical to dental health, to oral health. And if oral health is health, then this is a health policy that, in my opinion, needs to stay. So moving on from this topic, Brett, if that's cool, I appreciate the information on it. Here you've been the sitting president of the ADA now for several months. I'm just curious if you could share, what are dentists asking for? What in terms of what you've noticed? Obviously, this issue has sort of come front and center, and I think it's been hard to divert our attention in many ways away from it. But what else is brewing? What else are dentists looking for in terms of the ADA to stand behind and help support them?
So always insurance reform. The benefit system that we have is not working for us. It's worked for us for a long, long time. We never liked it, but it's worked for us for a long, long time. And now it's at the point where it's not working for us. And the reimbursement rates have not kept up with the cost of living, the cost of inflation. And therefore, then we have not been able to give our team the salaries necessary for a career opportunity to be with us. And now it seems that many of the workforce issues are because, our team, especially hygienists and dental assistants, it's not a career anymore for them. It's a job. And they're doing everything they can to make it, which I, totally understand. And I feel it has a lot to do with the benefit system. The benefit system is, as I said, the reimbursement rates are inadequate. The cap is not right. And it's designed to really not work. The stats from the National Association of Dental Plans year after year that people with a $1,500 max, less than 6% of people ever reach their maximum. It doesn't work. 94% never reach their $1,500 max. And it's because, in my opinion, because of plan design. The 100% for preventative services, the 80% for minor dentistry services, 50% for major. When it gets to the 50%, patients are very reluctant to take money out of their pocket and give it to us for their dental care. And they'll either, recalendarize it so they'll get more coverage that following year, or they'll just quietly go away. And then eventually it'll become a problem and have the tooth pulled. When it's at the level of 94% don't make it to what the benefit offers, that's a problem. So, we're pushing hard to get the dental loss ratio pushed across the country. Dental loss ratio, for those that don't know, it's basically it's how much money is spent towards dental care based on how much money is collected. And in the Affordable Care Act, in the medical side, it was mandated that 85% of all premiums collected by insurance companies go towards patient care on the medical side. So we're trying to get a very high level, a percentage like that. So we're pushing across the country. And as we get that across the country, I think we're going to see some improvement in utilization, because if it doesn't meet that threshold, then the insurance company has to give money back to those that are paying for those premiums. And dental insurance companies don't like to give money back, don't like to give money out at all. So, that's our own experience. And so when we see that utilization is not increased to a level that's adequate, then we could go after plan design and show the 180-50 isn't working. We've done modeling at the ADA where 80% for major restorative, so crowns, root canals, perio surgeries, things like that, utilization would go way up. And that's the goal, is to get people to maximize the use of their benefits. And then we will show that the $1,500 cap needs to go away, and that we can truly make it an essential health benefit, because, as you said before, oral health is health. And we know the improvement of the oral health in our patients will improve their overall health in leaps and bounds. And it's time for us to reconnect the mouth to the body, especially in the payer systems. And so we're working hard on that. But it takes a long time to create laws, because it's not regulated right now. So we have to create laws to regulate, and it's not easy. It's going to take a decade or so before we really see major changes, in my opinion. And so then we're looking at other ways to change the benefit system. And so in 2019, we took Delta Dental to court in a class action lawsuit to challenge some of the monopolistic practices that they portray onto us. And that was 6 years ago. And it hasn't even, hopefully this is the year that it'll be certified class action. We've been doing depositions for the last 5.5 years, but so that doesn't move very quickly. And another way we're trying to make changes in the insurance industry and the benefit industry is through ERISA reform. So we can do all these things to regulate the insurance benefit within the state, but then you get an ERISA plan that's administered federally, and they bypass the state rules because they're administered federally. And so we've had challenges in court where one judge said, hey, you can't do that. If you're participating in this state, you got to go by the state rules. Then we've got another judge that said you don't. And so we actually wrote an amicus brief that will be to the U.S. Supreme Court, and hopefully that will be heard. And we're feeling pretty strongly that it will be heard by the Supreme Court, so the Supreme Court can make a judgment on that. We're also looking at an ERISA bill that would, in the federal legislation, that would mandate that ERISA rules, they have to abide by the state regulations. And so we're working hard on that. And, we get, we hear a lot of criticism from members and non-members alone. We're not doing anything about dental insurance. And, we do so much, but it's a slow game. And we got to recognize that with this long game they're playing, this infinite game that we're playing, we're trying to get wins here and there. But unfortunately, we're in a culture that demands current, immediate gratification, immediate wins. And I understand that. I'm like that too. But this is not, those expectations are not realistic. We really have to be patient and keep moving forward. We have been splintered. You mentioned, we've worked with all of the specialty groups, and because there's never been a more important time for us to be a unified voice. And if we're not a unified voice, there are other entities that, especially the benefit systems, they will be the voice of dentistry because they have a 90+% market share. And do we really want that? So there's never been a more important time for our voices to be unified, especially around benefit reform. So, and then, in the private sector, we're making these moves. It's a long game, but in the public sector, we're trying to, right now, obviously preserve and grow Medicaid funding, because that accounts for about 40% of dental visits in this country. and that's being challenged. But in some states, like my state of Colorado, we've made some amazing strides in the Medicaid world, where we've actually truly made it an essential benefit, where there is no cap. And we're getting paid for the top 25 procedures at our full fee, the 100th percentile. We're getting our full fee for crowns. We're getting our full fee for root canals, for scaling and root planing. And as a result of that, our Medicaid providers have gone, the percentage has gone way up, and more people are getting care, and more people are being healthy. And then also we can go to some of the private dental benefit plans and say, hey, you're not even paying Medicaid fees. You need to raise yours. And we're seeing a bump in the private plans, the reimbursement rate. So we found that was a great lever for everybody to win. Back in 2023, our Health Policy Institute, monitors different trends in dentistry, and it monitored. This report specifically talked about the dental economy. The dental economy grew by $4 billion that year, 2023. All of that growth happened in the public sector. $3 billion happened in Medicaid, $1 billion in Medicare. There was zero growth in the private sector. And we're just reporting that for what it is. But if you want to see where opportunities are, that's the opportunity that we are looking at. And we're seeing an increase, like I said, increase in benefit on the private side when we focus on the public too. So it's win-win for us, win for our patients, and win for the communities, win for the economy. Okay. Back to fluoride, we've got these vulnerable teeth, and one small filling on a newly erupted adult molar will turn into a bigger filling, which will then turn into a bigger filling over the course of this person's life, which then will turn into a crown, which then may need a root canal and maybe another crown. And then a root fracture would deem an extraction, and a bone graft and an implant and another crown. There is an economy tied to that very first filling over the life of that person's, the course of that person's life. And so again, prevention is the key here, but we're not being paid for prevention. And I just put out a statement with Mark Motes and I can't remember, head of CGA, Jim Talberg, head of CDBP, our Council on Dental Benefit Plans. We put out a statement saying, and CAP, Jessica Robertson, that, hey, we need to start getting paid for prevention. It's going to save everybody money all over the place. So, that we're advocating in that way, because it's not working the way that it is. As far as workforce goes, because everybody's hurting for hygienists, everybody's hurting for assistants, and we recognize that, and it's been brewing, again, another perfect storm. In the hygiene world, we've been training one hygienist per one dentist for a long, long time. And in most general dental practices, it's one dentist would have two hygienists working for them full time. And so when COVID hit, many hygienists left the profession and sought their careers elsewhere, which was fine. Many came back, but now we're in a workforce crisis. And our House of Delegates, is I think pretty creative with some of the things that they're recommending. And, one of them was a fast track for internationally trained dentists. If they can deem competency in hygiene, then they should be able to practice as hygienists. And so once they can deem, competency, then they can get out in the workforce, which is great. We also opened that opportunity up for dental students to practice hygiene once they can, demonstrate competency. And so I'm not sure the dental student side will be a major impact, because it takes dental students 45 minutes to take an FMX. I don't see that working in the 1 hour hygiene appointment. We're trying to find creative ways to boost the number of hygienists in the dental economy right now. There's been states that have passed an OPA model for hygiene, and this is basically an oral preventative assistant, which can now scale teeth supragingivally with proper training. and and oversight of the dentist, and again, to get more access to care that we are so desperately craving right now, because there are not enough hygienists in the world, in the dental world, and our practices are suffering, and access to care is suffering on all levels of the delivery system. And so we're excited to see where that takes us. It is not a willy-nilly model. This is a model that was based on previous models, and it's being used in the military right now, and they call it a Profi Tech. And there's many advanced assisting accomplishments that you can train as a military to become a Profi Tech, and they've been doing it for years, very safely and very effectively, to keep our military men healthy, especially from an oral health perspective. So we're using that model, and excited to see where it goes.
Wow. Brett, so many reflections. First and foremost, just in listening to you, just starting from the end, moving back, this concept with the fluoride, the problem also in my mind is there's no fallback. The access to care problem has been in existence for such a long time. So you take away the fluoride and there's no fallback with an increased access to care. It's just it's scary to me. And I really hope that, cooler heads prevail, and we recognize that the history we've had with fluoride should stand as a really great body of evidence. But back to the rest. I mean, when we were on the podcast the first time, you highlighted your platform, and I know dental insurance reform was a huge part of that. I just want to acknowledge, for those dentists, dental students who are not participating in organized dentistry, if you listen to this and recognize the depth of effort, time, and certainly money that has to go into being an advocate for dentistry, it's tremendous. I think this moment in time, if none other, would sort of highlight to dentists, we need you involved in organized dentistry, whether it's actively as a leader like Brett is doing, whether it's just with your membership dues, but being advocates for organized dentistry. This is our voice. And without it, as Brett said, another voice speaks for us. And we all know that that's not ideal for our dental patients and for our careers. So, Brett, it's just amazing. I want to acknowledge all the leaders who put so much time. I mean, you were just saying you're on the road 3 out of 4 weeks a month right now. You have kids. Like, the sacrifice that you guys do to lead us, I just want to acknowledge and express my gratitude, because it's really tremendous. And so at a minimum, I hope that the call to action here is, join the ADA, join your tripartite, join your local dental society. Let's all contribute to organized dentistry so that the right messages, the right education, and the right voices are speaking for us and for our patients. So just wanted to put that out there, Brett, and appreciate the depth of which you answered the question, because I think dental insurance is a big issue, and ultimately our workforce issues are big. And I love what you said, my assistants are, I don't work with hygienists as an endodontist, but they are part of what we do. They're a huge part. And I love this concept of it being able to be a career for them. And I understand why the workforce issues exist, but I also hope that over time, it's really interesting to hear about what you guys did in Colorado in terms of turning, greater reimbursement with the Medicaid and resulting in something that was a win for everyone. I love the creativity. It's hard work. You're talking about years of policy and law and all these arguments and being in the courts, but it also takes creativity. And I love what you're saying about the Profi Techs and the concept that someone who wants to serve and help other people can absolutely be trained. And if above the gum tissue creates a situation where we minimize risk, but maximize access and health, I think that's tremendous. So thank you for the thoroughness of your answer. As a last topic, I don't want to take too much of your time, but something that I know is, this is for us, me and you, and for many of us, mental and emotional health, burnout. This is always just, such a huge thing. And with all of this going on, workforce issues, reimbursement issues, all these different things circulating, we already had a tremendous amount of stress and pressure. I know that I'm really, as my life purpose, I'm really putting forward what I can to try to contribute back to opportunities for dentists to build more resilience from the stress, to really, be able to rise above with learning new tools, how to actually cope with all of the things coming at us. Something I've been developing with some partners is called Heal Thyself. It's a company called Tailwind Trainings, where we're trying to build, in essence, what we call a clinician resilience system. So, Brett, tell me, out in the world, you're interacting with so many dentists. In your own personal opinion, what is the level of burnout, stress, anxiety? I know you mentioned it in the article for the AAE, but I'm curious, how are you viewing the sort of mental, emotional state of the dentist in 2025?
I think that we are being challenged at the highest level that we've ever been challenged. We've done studies where we've seen 80% of our colleagues are showing signs of clinical burnout. And that's too
Bad.
much. We've got some new studies that are about to be published about that, because we have the well-being index that's administered by the Mayo Clinic, and we've got 1,500 dentists that check in on a pretty regular basis, since we get to monitor, that demographic and how they're doing on a monthly basis. So we're going to have some good data on that soon. Gosh, I know of a dozen of our colleagues who committed suicide last year. I know of a dental student, I think, that just committed suicide a few weeks ago. It's still prevalent, and we need to make sure that we are there for our colleagues, and that we don't penalize people for getting help. And so we are, doing our best to destigmatize some of the licensing questions and the credentialing questions, because the questions are, lead to punitive measures, and that can't be. And we're making big strides with that too. We have a new resource, which I'm really proud of, called Talkspace Go. And it's an app that, has a bunch of, mental health resources that, you take a little test, and, it spits out a report based on how you answer the test. You may be suffering from depression, and here are some articles on what depression is. Here are some signs to look for. Here are some breathing exercises over in this corner. Here's an online yoga class that you can join in with some other people. Here's a chat room for other people who are in the same boat you are. And it's a private way that people can access help. And oh, by the way, here are 3 therapists and counselors that are in your area that you can access, as part of this app through being an ADA member. And you can access it, at the convenience of your own home or your office. You don't have to take off work to go to that person's office and, do the thing. So really proud of that. But let's say you're not suffering from depression or things like that, or you're just looking to improve, your leadership. We have the Dale Carnegie online library that we are gifting to 1,000 of our members. I still think we have a few hundred opportunities for people to enter that, where you can access all of their online libraries as an ADA member. When I started out with some serious, mental illness issues, and I'm a recovering addict, if those of you who don't know, and I called the Dental Association for help. They guided me to help, and I feel like it's my mission to talk about it, to lower that stigma, and as an example, to show that, when you hit a bottom like that, your life isn't over. That chapter of your life is over. And then you can, you turn the page, and you've got a blank page in front of you, and you can write a good story. And, here I am as ADA president. I'm in recovery from substance abuse disorder. Okay. But I'm ADA president. I can, you can overcome, and you can recreate and rebuild and build it better than you ever imagined. But it's going to take effort. And throughout my course of time, the last 26 years, I started a practice from scratch, and I hired a coach, and this coach guided me and kept me motivated, and it was a sounding board for me to grow. And I took a bunch of Dale Carnegie courses, and I took a bunch of other leadership courses, and that leadership continuum that I was on really helped me stay better emotionally. And I was able to really follow what my true vision has been for not only my practice, but for my life. And so we've got all these resources now that the ADA and organized dentistry has. Many states have their own version of that, and please access that if you are struggling. But we've got these resources that allow us to grow and be our best selves. Not just be our best as a dentist, but be our best human that happens to do dentistry.
Mhm.
And when we're like that, we do it really well.
Yeah. And, I think one of the most powerful forms of leadership is showing your vulnerability. In 2018, I hit a level of burnout that was so scary. I honestly, I had discussion with my wife about whether I wanted to even continue to be a dentist. It was just too much pressure. And it was through emotional intelligence, it was through leadership training, it was through resilience training that I really started to feel that zest for life and be able to start to accomplish things away from just being a dentist that were important to me. And as I started to go through the process, I was gaining so much that I started feeling like I wanted to share this with my colleagues because we get none of this education. And so it's really powerful, like Brett's story with addiction, my story with burnout. And so the point being is that I think the stigma has to be busted open because I think most dentists are feeling some form of the pressure, and the way you respond to it might be the way you're conditioned. And ultimately, we can recondition ourselves to be more resilient, to be more full of life. Because here's the thing, we didn't sign up for this to become dentists, to become healthcare providers, to have a miserable life and to always be giving to everyone else and be empty inside. We wanted more than that. And that is possible. It's within each of us. All it takes is just saying, you know what? Like Brett, like the two Bretts, I've been feeling kind of desperate too. And maybe I can follow, at least initially, their lead and then find my way on my own journey. But that's what Brett's espousing. That's what I am. I've teamed up with Dr. Julie Wilkes and Chris Hawker, who are incredible emotional intelligence and facilitator experts. So what we've curated is sort of programs where you're getting the emotions and the stress that I can translate and then being able to facilitate it beautifully. And so in concert with what the ADA is offering, I hope more people will step up to the plate of recognizing where they're suffering and then do something about it. And the way I look at it is it's investing back into yourself, filling your own cup. And Brett's a great example of that. And I want to acknowledge again, all that you've been able to do to rewrite your story. Like you said, I love how you said that, maybe that chapter of your life has been that way, but here's a new chapter, a new page, a fresh start. All it takes is the mindset that, you know what, I'm going to learn my way into a new conditioning and way of being. So really want to acknowledge and thank you, Brett, for everything you're doing. Brett, as we're checking out here, I would love to just ask one final question. You've got a dental student in front of you. And as you just said, dental students might be more vulnerable to the stress and burnout than even dentists because of all of that, what is poured onto them and mentally trying to prognosticate what their career will be like. And are they good enough? And it's self-worth and it's confidence and it's so many things. But after just sharing that a dental student recently took their own life, you have a dental student in front of you. What's one piece of tangible advice you would offer that student to just help them kind of remain balanced as they go through each step of the career from where they are into hopefully a happy retirement? What's one piece of advice you'd offer, Brett?
I just came off this week. I was the commencement speaker at South Carolina's dental school. And then I got to visit High Point University in North Carolina, Eastern Carolina University, and the University of North Carolina. I got to meet so many amazing dental students. And I love when I get to be around dental students because they are wide-eyed and they see this future that is unlimited, which is amazing. And so I get asked a lot by dental students, what is the future of dentistry like? Or, should I take this job or should I take this job? And I tell everybody, take a vision for your life. Where would you like your life to be in 5 years? Not your dentistry, but your life. Okay, where do you want to live? Do you want to have a partner? Do you want to have kids? Do you want to have a house? Do you want to go in a travel? You want to do all these? Okay, and then what kind of dentist do you want to be? Do you want to be a specialist? Do you want to focus on certain areas of dentistry? Do you want to focus on certain demographics of patients? What style of dentistry do you want to do that fills your cup, but also gives you the wherewithal and the means to do those things with life? And that makes it so much easier. And your first job will not be your last job for most of you. And don't get so hung up on this has to be the perfect opportunity, because I think going through up and downs and different job opportunities, you learn what you're really good at, you learn what you really like, and more importantly, you learn what you're not really good at. And then can you bolster it with taking some CEs, or you learn what you don't like, and through the experience is where you learn it. And and within about 5 years, that's when you're really developed your style, your communication style, your dental style. But that's where you should be really starting to live your life to the fullest, because dentistry offers this means to live our best life and make sure that happens. And dentistry is great, and dentistry is a big part of who we are, but it's not who we are, it's what we do.
Mm-hmm. Wow. That's beautiful. And I support that answer in every aspect. And I'll add one piece, which I always say too, is be kind to yourself. Be kind to yourself. Be graceful with yourself. It's a learning curve, and you will make mistakes. You will do things that you can't believe you did. And if you can take that as learning, as a foundation to build upon versus something that tears you down, you will find a much better path and a much easier path emotionally. Brett, as I'm sitting here looking at you, I see vision, I see leadership, I see recovery, I see redemption, and I also see someone who loves people. Brett, we are so grateful that you are our ADA president, and I love that it feels like you and Rich are just working so well together. If you have a successor that also is sort of in with what you're doing, and we start to weave, because as you talked about, so much of policy takes so long. I just love what I'm seeing in terms of cohesiveness from the American Dental Association, its leadership. I'm in full support of what you're doing, and I'm here if need to be called upon for anything at all, but mostly just grateful for your friendship, because I know when all this is said and done and we are no longer these vibrant, active, leaders and providers, we're going to be buddies and friends. And I look forward to spending that time with you. So Dr. Brett Kessler, thank you for your time, for your expertise, for your care, and most importantly, just for being such a strong advocate for all people, whether they're wearing scrubs and a white coat, whether they're visiting the dentist. I believe you're truly living up to the mission of the ADA, and couldn't be any prouder of you, buddy.
Thank you so much, Brett. I love when we get together. Something good always comes out of it. I know it. And this was no different, for sure. So I look forward to seeing you down the road, and I'm going to put my new cup that I got from Dr. Jennifer Dubrow. Keep on keeping on, my friend.
Keep on keeping on with Dr. Brett Kessler. Thanks, my man.